So we're going to discuss the skeletal anatomy relevant for the peripheral nerve divisions of trigeminal nerve. And we will discuss particularly the supraorbital, infraorbital, and the mental nerve block. These blocks are very useful for patients with trigeminal neuropathic pain or during the acute episode of trigeminal neuralgia, where you could block these peripheral nerves to reduce the intensity of pain. To perform this procedure, the skeletal anatomy is very important. As we know, the supraorbital ridge has a discontinuity. That's where you would be able to locate the supraorbital foramen, and the foramen has a supraorbital artery which you can put the color Doppler on the ultrasound to locate. And you can do an out of plane technique or you can do an in plane technique. So the steps would be to start scanning the top of the eyebrow, moving the ultrasound probe medially, looking for the supraorbital notch along with the supraorbital artery located in the supraorbital notch. And then you can do an in-plane technique, coming in with a 25 gauge needle and injecting the local anesthetic and steroid. Similar fashion, you could start to scan for the infraorbital foramen, where you would put the ultrasound probe on the top of the infraorbital area, where you will be able to find the infraorbital foramen, where you will be able to also see infraorbital artery, and the nerve accompanies the artery. And the similar fashion, you can bring the needle in plane technique using the ultrasound guidance, targeting the infraorbital foramen. The mental foramen, to scan this, you would use the ultrasound probe and place it on the mandible, moving the ultrasound probe more cathephalad and more medially, looking for the mental foramen, which contains mental nerve and the mental artery, and you will be able to use an in-plane technique to block the mental nerve. Thank you. We're going to talk about the peripheral branches of the trigeminal nerve. This will include supraorbital nerve, infraorbital nerve, and the mental nerve. To perform this block with the ultrasound guidance, we'll start with the supraorbital nerve. Place the ultrasound probe on the lower part of the forehead, moving it onto the supraorbital ridge and moving medially and looking for a gap in the supraorbital ridge, which will show you the supraorbital foramen. So I'm just going to locate that, and here in this image you could see that we have located the supraorbital foramen along with the supraorbital ridge. So we have supraorbital ridge along with the supraorbital foramen, where you have also supraorbital artery. You can bring the needle in plane from lateral to medial and inject in the supraorbital foramen. This will be blocking the supraorbital nerve. So the needle position would be from lateral to medial, in plane technique, coming in and blocking for the supraorbital nerve. Similar fashion, you will place the ultrasound probe on the upper part of the maxilla, looking for the infraorbital rim, and which will also then depict the infraorbital foramen along with the infraorbital nerve and the artery. So we have a infraorbital ridge, and here we have the infraorbital artery, which has accompanied nerve. You will bring the needle in plane from lateral to medial and injecting the infraorbital nerve. To perform the mental nerve block, the position of the probe would be on the top of the mandible, where you would then look for the alveolar margins. Along with that, you will move on down caudad, where you will be able to locate the mental artery accompanied by the nerve shown in this image, where we have plane or an in plane coming from lateral to medial. So the position of the probe would be something like this, along with the needle coming in plane. Thank you.